probably heard me speak about expanding Medicaid in the state of Georgia. It's true, I talk about it quite a bit.
In her ads and on the campaign trail, Democrat candidate for governor Stacey Abrams says Medicaid expansion will create 64,000 new jobs and help save rural hospitals. We asked Chris Denson with the fiscal conservative group Georgia Public Policy Foundation and more liberal-leaning Leah Chan with the Georgia Budget and Policy Institute to weigh in on those claims.
Rural hospitals in particular are safety net hospitals.
Which means they treat a higher percentage of people who are on Medicaid or uninsured. That's why they're struggling. Even in Metro Atlanta, Wellstar will close 2 hospitals after more than $100 million in losses last year. So yes, increasing the number of people with insurance will increase the amount these hospitals get paid. But, and as you'll see, there are a lot of buts. Because Medicaid reimbursements are actually lower than the cost of care, Denson says this will just slow the bleed, not cure the wound. As for jobs, the theory goes the more people who have insurance, the more people will go to the doctor.
So that's new jobs in healthcare, that's new jobs in construction, in retail.
But, Denson says, we've expanded Medicaid several times in the past 20 years, and the impact on healthcare jobs has been mixed. Plus, he says coverage doesn't mean access.
Only 64% of healthcare providers accept Medicaid patients, and only 60% of those are accepting new Medicaid patients.
That's why Governor Brian Kemp says he is focused on trying to move people onto private insurance.
Most rural hospitals survive off commercially insured patients.
Is it realistic to think that the income brackets we're talking about are ever going to be able to afford the costs that are associated with that commercial insurance?
One way is to increase the number of providers in a lot of our what are known as health provider shortage areas.
Denson has some ideas on how to increase providers, but they all take regulatory change and time. Supporters argue Medicaid expansion is a fix now. Here's the thing. There are states that expanded a decade ago, so there's a lot of research on the topic. Kaiser Family Foundation reviewed more than 600 of those studies and found the majority show access to care, financial security, the health of residents, and the economy improved in states that fully expanded Medicaid.
Access to healthcare can help us meet our basic needs in a way that allows us to contribute at home, at school, at work, in our community. And it really is just a basic human right.
But is it a human right? And if so, is it the role of the government? Is Medicaid really the right type of insurance to offer? Those are questions you'll have to answer when you head to the polls. But if you want to dig in deeper on this, we've put links to research on all sides of the debate on 11alive.com.